going to see a patient who has plantar fasciitis, and that's pain at the bottom of the foot. We're gonna be working on him, giving him some therapy and break some things up. So check it out. Hey,
Hi.
how are you?
Yeah.
It's good to see you.
Yeah.
You all right?
Yeah.
Perfect. Perfect. Let's have you go on your stomach. Good. How do you feel?
Yesterday and today okay.
Okay.
And only the left side hurt a little bit.
Okay.
Only the bottom.
On the
Yeah.
bottom. Okay.
Yeah.
How's the right side doing? Any pain on the right?
No, the right side right now okay.
Okay, that's perfect.
Yeah. Only the left side number one.
Good job.
Before you show me number one and number two.
Yes.
Yeah. Right now number one.
Okay.
No, only the left side.
Only the right side.
No, right side. Right
Right
now.
side zero pain. The left side pain
right,
here.
Yeah.
Got it. Patient walked in with severe daily morning pain in the bottom of the foot, as he stated right here, and it migrated towards the mid region of the foot and into the heel. So typical, very, very typical plantar fasciitis. That means that we have a very thin layer of tissue that hooks from the bottom of the heel. It extends its way down to this area of the foot. Now, this is free flowing. This mid region is free flowing, so it's not attached to the foot. So it hooks onto here, and it pulls, bringing in these together. Now, when the patient has extremely flat feet or is on his feet too long, barefoot, it starts pulling that thin layer of tissue from here and from here. And sometimes it even starts tearing because this is being stretched out way too much. Now, that causes an inflammation and pain process here and here. And that's what we're doing here at this point, is that we're breaking up the tension here to release it from the heel and from this area of the foot. Okay, here we go. So what I'm doing here is I'm scraping that plantar fascia. And we have tissues here, we have muscles. They all hook on to here. I need to break up that tension so that it doesn't pull here and here. It's obviously a little bit painful, but it helps significantly with pain, especially in the mornings. In the mornings, it sucks because it feels like your foot's going to tear from the bottom. So for all you guys who feel that pain on a regular basis, I know what you're feeling. It's painful.
Doctor, you think I apply from the bottom more or no? 3 times a day or 5 times a day?
I still recommend you keep the same intensity thing, like 5 times a day, just because it seems like you're starting to get better.
Okay.
And the last thing that you want to do is lay off of something that's actually working. So keep it the same way, even though it's not hurting. So I'm having him ice.
Okay.
Yeah, perfect. 5 times a day, 15 minutes apiece.
Okay.
And that was a great question.
Sometimes only 3 times a day.
Yeah. You know, not many people got that much time for icing. I get it. So, and that was actually a really good question. He's asking me if he should continue icing. I mean, he was like at a 9 out of 10 pain, right? 10 out of 10 pain in the mornings. It was painful, right?
Okay.
It was very painful before, right?
Yeah.
Yeah. So, he's really progressed. He's gotten a lot better, and I'm actually very happy about that. Because some patients like really want results quickly, but man, just give me a little bit of patience and I'll get you there. And I had him icing 5 times a day, 15 minutes apiece. And although that does sound aggressive, you want good results, man, you gotta be aggressive. That's what training, nutrition, therapy, your body, performance, you name it. You have to be aggressive. Business, same thing. So I was like, okay, I want to leave zero doubt on the table as far as like, did we really try? So obviously breaking it down a lot for him and had him go home and ice it a lot. So it seems like it's working. He's at a 0 out of 10 pain here. He's minimal pain here. So he's asking me if he should continue icing, and the answer is yes, absolutely. Like, don't wait for it to come back. to actually continue icing? So that was a great question. You okay, I think?
Yeah.
Good. Okay. I also like to loosen it up with certain tools to just get some more laxity in there. Remember, the more laxity that you can get, the less tightness that you have within these plantar fasciitis muscles, the more mobility, less pain here and less pain here. That's why they actually recommend the ball, rolling on the ball or rolling on a frozen water bottle. Very, very important. And it's painful. I mean, a lot of patients hate me when I'm doing this, but ultimately is to not show you too much of a good time, but give you the gains. Remember, plantar fasciitis is an inflammatory process, so you want to do anti-inflammatory methods like icing and therapy and stuff like that. So it's all about loosening it up. After you loosen up, address the inflammation. So obviously the next question would be, okay, how do I get rid of this plantar fasciitis and what do I have to do? So a few things here. Therapy is first and foremost. You need to start getting to therapy, somebody that could break up that scar tissue, help with the swelling, put some therapy on it. Number two, very important, is ice. There's this misconception about like heat and ice and when to do which and stuff, but if you have an inflammatory process such as plantar fasciitis, the best thing that you could do is do something that's anti-inflammatory, and ice does that. It takes away the swelling, takes away the edema that's caused by all that. And number three, if you have flat feet, it's very important to get supports, tailored supports, not these cookie cutter supports from Walmart. Dr. shows is going to last for 30 to 60 days. It's unreasonable. Your 2 feet aren't even the same. So how are we going to put a cookie cutter insole for support on both? You may need more support on one area of the foot and then the other ones. And ones that I really like are the foot levelers. We do a foot scan in here with a laser. It scans the bottom of your foot and it tells me how you're distributing your weight from left to right and compares that and offers a proprietary insole just for you. This is just for the right foot. This is just for the left foot. They're not even the same. It's pretty amazing. Provides the arch support here, transverse support here of the arch, and the lateral aspect of the arch. So these are pretty phenomenal, especially if you're on your feet all day, have plantar fasciitis, non-negotiable. You need these. So hope that helps.